All right. I want to go very quick. I'm going to play a clip from Senator Mitch McConnell on the Senate floor earlier today talking about, all this stuff with the coronavirus, the COVID, and how a lot of the world is now realizing, look, it's time to stop it. Well, it's time to pull the plug on this pandemic mindset here in America as well. Play the clip, please.
It's time for the state of emergency to wind down. But disturbingly, whether or not we should trust the science and reclaim normalcy is somehow becoming a partisan question.
It is. Science is no longer really the guide that we follow. Now, you might remember back in June of 2020, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, claimed in an interview that the COVID shutdown saved millions of lives at a time when there were more than 2.1 million confirmed cases of COVID in the United States and nearly 118,000 deaths. Play that clip of Dr. Fauci.
People get confused and they say, wow, we shut down and we caused a great disruption in society. We caused great economic pain, a loss of jobs. But if you look at the data, now that papers have come out literally 2 days ago, the fact that we shut down when we did and the rest of the world did has saved hundreds of millions of infections and millions of lives.
But a new meta-analysis conducted by a team at Johns Hopkins University has concluded that the, quote, lockdowns have had little to no public health effects. They also found little to no evidence that lockdowns had a noticeable effect on COVID mortality rates, reducing mortality in the United States and Europe only by 0.2%. While every death is a tragic loss, did the lockdowns do more harm than good? With me to talk about this and more is Dr. J. Bhattacharya. He is a professor of medicine at Stanford University and one of the authors of the Great Barrington Declaration, a statement advocating an alternative approach to the COVID-19 pandemic. Dr. Bhattacharya, welcome to Washington Watch.
Thank you for having me.
So your thoughts on this report out of Johns Hopkins?
Well, first, may I just make a comment about what Dr. Fauci said in June of 2020? He was reflecting about a paper that had been published earlier that did a model of how many lives would have been lost without a lockdown. This is an example of garbage in, garbage out. The model built into it had this assumption that if you locked down, if you kept people apart from each other, if you closed schools, if you made funerals so that only no one could attend, if you had forced people to die alone, well, then you would save lives, the COVID would stop spreading. And then they compared that against how many people actually died and said, oh, look, we saved 2 million lives or whatever the number was. That was false then, and it's false now. It's a very simplistic model of how the world actually works. The actual experience of a lockdown in rich countries like the US it's a certain class of people that can benefit from a lockdown. People who don't lose their jobs if they work from home, stay home, stay safe. Well, that only worked for a certain group of people, a laptop class. For most of the country, they had to go to work to feed their families. They had to go to work to take care of society, keep it going. And so it's not a surprise that this new study that looks at actual real-world evidence of lockdowns finds so little evidence that it actually worked. It doesn't actually, although it may be attractive to some people to think about, well, if we just stay apart, the disease stops spreading. That isn't how societies actually function and cannot function. The lockdowns themselves were cruel in what they did to people, to keep people apart, instilled fear in people, and yet, nevertheless, the disease spread. And 80% of the deaths have been above the age of 65 because the disease is so sharply damaging people older. Well, lockdowns didn't stop the spread in nursing homes, where 40% of the deaths are. They're an absolute failed policy, probably the single worst public health mistake I've seen in my lifetime.
So when you look at public policy decisions, as you just articulated, a host of issues related to lockdowns. I mean, you have economic issues, you have social issues, you have mental health issues. But when you ask someone who's in charge of infections to give you, hey, what should we do about these infections? Well, if he's only focused on stopping the spread of an infection or a disease, but not all of these other factors which public policy experts should be focused on. I mean, this is like asking a mortician which vitamins to use. I mean, you have to get a holistic picture of what is best for society. And I would submit that we chose the wrong model.
Yeah, in fact, it was, if you recall back, the mantra was, well, you can't, if you don't have expertise in epidemiology, virology, or immunology, you're not allowed to speak up. Well, I'll tell you, like most epidemiologists, most virologists, most immunologists, they may be very good at their field, but they do not have anywhere near the breadth of vision to understand how society should be structured, how we should organize our life. They don't know if, for instance, I'll just give you one example. I think it's close to home to many people here and abroad. Is keeping kids home from school really keeping them safe? Well, what happened was during the lockdowns, the sharpest lockdowns, child abuse reporting went down, but child abuse actually went up because it's schools where child abuse is caught and addressed. The depression rates went through the roof. So 1 in 4 young adults in June of 2020 seriously considered suicide. Tens of millions of people around the world, because of the economic harm by the lockdowns, were thrown into dire food insecurity and poverty. In March of 2021, the UN estimated that 230,000 children had died from starvation and skipped medical care in South Asia alone. You need a wide range of expertise to know about these things. Right. You cannot have society run by a narrow class of scientists, and you certainly cannot have it all that power in the hands of one man who controls the budgets of an enormous number of scientists. Who, like, if a lot of people who had a lot of trouble with these lockdowns as an idea a lot of qualified people stayed silent because they feared that their reputations would be harmed, their ability to get grants would be undercut, because the person in charge of the lockdown policy was also in charge of scientific funding.
That's not right. There's a problem with that model.
Yeah, I mean, it's.
And you forgot to mention one other aspect, that we saw this spike in drug overdoses as a result of the mental health issues and the other issues related to the lockdowns. So, Dr. Bhattacharya, all right, we have a little bit of a frame of reference here. We've got 2 years. We're now beginning to have some analysis of the data, but there's still, quite frankly, I think, fear of really looking at the data because of the cancel culture and how everybody's just kind of caught up in this mob mentality when it comes to, oh, you got to get a vaccine, this is what we've got to do. But when you begin to look at the facts and they're not adding up, it undercuts the credibility that those government voices have. And now when you see Pfizer appealing to the F.D.A. to get approval under the emergency use provisions of vaccines for babies, I mean, this is going to cause some people to ask questions. Are we rushing this? Is this moving too quickly? Do we really need to do this? Because this is going to most probably lead to more mandates.
Well, I mean, if you look at the data on who's actually vulnerable to COVID, there's an enormous difference between the risk posed to children who face vanishingly lower risk of dying from COVID than the flu, especially young children, compared to older adults. Before the vaccine, the death rate among people over 70 was something like 3, 4, 5%. For children, the death rate from COVID infection is less than 0.01%. So the risk that you're protecting these little babies against is vanishingly small. On the other hand, there's still risk from the vaccine. The trials that looked at children enrolled fewer than 5,000 patients overall in the 6 month to 5 year old age group. 5,000, and they didn't even have as an endpoint the prevention of disease. All they had as an endpoint was the production of antibodies. This needs far more study before it is employed at population scale to babies. I mean, it may be safe, it may not be. It's hard to tell from the data that we have alone that on which Pfizer is basing it. It certainly would need to be The evidence on establishing efficacy needs to be far better than it currently is, and I worry very deeply, as exactly as you said, Tony, that people will use this to restrict the activities of parents and kids unless they get vaccinated, essentially forcing parents to decide to vaccinate when it may or may not be in the best interest of their children.
I mean, you and I think we've talked about this before, the anomalies here and how we are treating COVID unlike we've treated any other disease or illness like this. And so we're cutting corners, we're doing things rapidly. And I understand it at first. It was being done, but now we're beginning to see a better picture that there were certain voices speaking into the public policy arena that had a very narrow view of what needed to be done. So on the backside of this, well, actually, we're not on the backside of it because we're still having these mandates here. But are you finding among your colleagues more of a willingness now to speak out as more of this evidence is coming forth that question the decisions that have been made to this point?
Yeah, I mean, I think what we're seeing is that people are starting to speak up. The depth of destruction wrought by these lockdowns is enormous and impossible to ignore. And the failure of the policy, I mean, what was the promise? The promise was that we would get rid of COVID, have the virus under control. I mean, how has that worked out? The failure of those promises has started to lead many people to start speaking up that were silent before. It's interesting, the strategies, Tony, that were used, that Dr. Fauci and Dr. Collins, who was the head of the NIH, Dr. Fauci's boss, used to try to marginalize voices, scientific voices. When I co-wrote the Great Barrington Declaration in 2020, calling for a focused protection strategy, 4 days after we wrote it, Francis Collins wrote an email to Tony Fauci calling me a fringe epidemiologist. And I work at Stanford. I may not be right or wrong, but I don't think I'm a fringe epidemiologist. Although now I put it on my business card just for fun. And then he called for a devastating published takedown, which came in the form of an op-ed in Wired magazine. Not a scientific takedown. This is a strategy they used when there was early in the epidemic. There was this question whether the disease might have been originated in a lab in Wuhan, China, rather than they organized a devastating takedown of fringe scientists who dared to say that it might be a lab leak. They did the same thing with people who said, well, look, there may be cheap repurposed drugs that might work here. They call these scientists fringe and marginalize them. It's a strategy that you've seen Tony Fauci use throughout the epidemic over and over again, whenever there were scientists outside with some expertise challenging his wisdom. And it is no way to run health policy anywhere in the world.
Dr. J, final question for you. Will science recover from this in terms of its credibility with the American people? How long will it take if it does?
I mean, I think a lot of reforms are going to need to happen. We cannot have such a small, narrow group of people in charge of science. And we certainly should have a bright firewall between people who fund science and people who make health policy. It is now very clear that the level of power, when you give a single person or a small set of people, both of those roles, you create an opportunity for corruption that I think most of us didn't realize existed before the pandemic, but we do now. So if science is to be reformed, we need to reform that.
That is an extremely good point, and I'm going to follow up on it as well. Dr. Bhattacharya, thanks so much for joining us. Always great to talk with you.